Man, we got a chance to chat before we hit record today, and I can already tell it's going to be an interesting conversation. So, why don't we start where I think it makes it always makes for a good story to understand a little bit about the person we're talking to, right? And it lowers even the listener's defenses here. And so that is, do you yourself come from a family of entrepreneurs invested in healthcare in any way whatsoever?
Funny enough, I do come from a family of entrepreneurs, but not in healthcare.
Ah,
My grandfather was a barber, and
nice.
my other grandfather owned a bicycle shop. So that spirit of building something and offering a service has always been instilled in me. And really, a hokey way, they've always been involved. My family's been involved in politics and wanting to change society. So they were not only business people, but they had a lot of activity in terms of local government and what have you. That was instilled in me at an early age. And I chose to go into public service in a sense by choosing the healthcare route. I could have made a lot more money going into business using the same concepts earlier in my career, but I chose a not-for-profit route because there is that mission aspect. It meant something to me, and I had a big interest in helping people. And at the time, the nation was kind of going through this whole managed care thing. And there was a lot of talk about patients needing better care and what have you, and it intrigued me. I started, the healthcare executive route, went down that route, and then got involved in helping systems improve, overall systems, and building business units within healthcare and working with senior executive teams. I transitioned out of working at one system and started in consulting. And in consulting, I started doing interim executive consulting, which is more short-term, rapid building up a business or reforming it, and having to work with teams of people and a culture and change it rapidly. And what I found is that over time, that is, in a sense, that turned me even more into an entrepreneur, because I'm building businesses within businesses. I'm having to do it rapidly. I am held on the hook if I succeed or don't succeed. And as I went through that journey, flash forward 20 years later, I'm still in healthcare, working in consulting. And I was frustrated by the fact that healthcare labor was always stuck in its full-time equivalent box, no innovation or limited innovation, but people wanting to innovate, but it just simply didn't have the tools and technology or wherewithal to engage with Silicon Valley people who spoke a different language, who may not have respected healthcare's unique culture, and the fact that healthcare is filled with multi-billion-dollar regional companies that rival any IPO, and with very astute business people who, when a Silicon Valley young person comes in there and says, I got this great idea for you, but they don't understand the culture, the language, and the business sophistication and change management to make it happen. I wanted to be that bridge, and I had an intense interest in labor marketplaces, Uber, Lyft, but applying that concept to a complex industry like healthcare. And by chance, literally by chance, I was talking about this at the AHA Senior Leadership Conference. I don't know, I think it was 2018. And I ran into this young former ICU nurse who inspired me. He went through Y Combinator. And for those of you who don't know what Y Combinator is, it is kind of like the gold star in terms of startup culture. And he went through that and started this company that focused mainly around outpatient surgery centers, and it was starting to enter into hospitals. And I said to him, hey, I really want to change healthcare. I want to do this. I want to build something new around labor innovation. This platform seems to have the ability to do that. Let's work together. He motivated me to do this, and we worked together. And with the team that he already had, an excellent team. I mean, his partner, his wife is amazing. The CTO, Derek, worked at the pre-Uber Taxi Magic. We had all the necessary elements And we brought together the best of healthcare and the Valley and made it happen. It was hard, but the Valley and investors don't like enterprise sales, and that's what healthcare is, healthcare systems in particular, because it takes a longer tail time period, but it's heavily sticky. And if you're providing a lot of value, you have a customer that really respects you and is a partner. It's a different model than most startups that are consumer oriented and are very short-term sale oriented. So we actually created and are creating a market that's brand new around labor marketplaces for healthcare systems that is very sticky, helps fill the supply gap in healthcare, and helps patients get the care that they deserve at a cheaper rate than, say, going with a travel agency or one of these other companies. So we're breaking the model, and it's fundamentally different, and it's been a great ride ever since.
It absolutely needs it, what you're doing. My own girlfriend, she's a nurse, and just even after getting her NCLEX and the state license to do it, finding a job, even though there's a labor shortage, getting into to get the job is this whole process that needs total revamping, because you're right.
Yep.
It should be, once you're qualified, it should be like a Uber or something where it's like, oh, look, they need somebody and I'm close by. Let me go make sure I can deliver on that. And there's like reputation and all that. Oh man, and when you speak, I hear you understanding the language of both worlds. I hear you being able to hear healthcare professionals speak and then turn and look over at the people in the Valley and say, so the way this would make sense for you is, and somebody has needed to do that for a long time now, because you're right. It's always been someone coming in saying, well, I've got all this money and I've got an idea. And then it's like, whoa, but there's all these traditions, standards, and
Right.
things that like we need to make sure we cover before we totally revolutionize the industry or whatever it is. So hearing you say these things and getting a chance to know you as you're talking about it and where you come from, I'm actually really excited about where you're going to take things forward. So why don't we open up a little bit about, like, what are you in consulting alone, or do you have like a company itself? Because I know you're working with this ICU nurse. Are you still working with them, or have you developed something and then moved into something else? Like, tell me more about what you're doing right now.
So I transitioned out of consulting and went full bore and committed to working with CareRev. And CareRev is doing exactly what you talked about, building that marketplace, locally curating it around health systems and their unique needs, and digitizing that onboarding credentialing process, as well as making the professionals better aware of the price, what they're walking into, and offering flexibility. So we're sourcing people that never, ever, ever would have considered working per diem or on demand in healthcare, because it's too hard. What you just said about your partner, in terms of she was having a hard time even getting hired and going through the bajillion steps and everything else in between, right? We streamline that through our technology, maintaining the quality, providing a layer of transparency around it, but also we engage professionals and source them differently, meaning our technology is leveraged to identify them, source them, refer them in through our app. So friends refer friends. And then if you like them, you can hire them. That's fundamentally different than a staffing agency or travel company. We're a labor resiliency partner, a technology enabled service, a technology product forward platform that connects people and removes barriers between them so you can fill shifts, meet patient needs. I'll give you an example, okay? People who walk up to me to talk about CareRev, they say three things. One, wow, why didn't anybody think about this before? Two, it's amazingly easy for me to figure out what I need to do to get into a healthcare system and when shifts are available. Three, I do this at my own leisure. So I have kids at home. I have a parent that's ill. I am retired, but I want to work 3 times a month. I can't work for it full time. I want to pay off some debt. I'm a CNA. Instead of working at a fast food job, I work in another CNA job. These things matter to people. Flexibility in our culture is now expected, and healthcare traditionally in the past has only offered one flavor. Here's your full-time equivalent box, and you're going to get benefits. We're not going to pay you the best, but you're going to get this. And it, by the way, it's 40 hours a week. Thank you very much. So we're offering a different mindset. I'm not advocating not to have a full-time platform, but you can't source people that way. You got to go where they want to work. And in an era where everybody is saying, I can't find nurses, I can't find people, we have more than enough supply waiting to get into shifts. Think about that. Because we offer a marketplace that is dedicated to healthcare systems, it's local, and we offer flexibility, it's different. And it's what they want, the professional ones.
I want to learn more about CareRev and what you're doing, because what you just broke down is truly needed in the industry. I mean, it's crazy that I have a point of reference, truly like a personal point of reference of the labor market you're trying to help assist, while at the same time also helping solve the problem for the market itself that's looking for this type of labor because of their traditions and the way they're set up. They're saying we can't find nurses, and then nurses are saying we can't find jobs. And it's like, okay, something doesn't make sense here. And you saw that and said, and I can solve this. And I'm passionate about it. I have to ask, is there a particular reason to you? Like, did you have someone in your life who was sick or something? What drives you? Because there's no way you're doing this for the money, because you've already said that. But there's got to be something that's truly driving you, a point of passion that I just have to know, because there's no way you can get up every day when it's going to be hard, because it's healthcare. It's got to be hard. How do you get through this? Is it just drive and grit, or is there something in your life that really pushed you to like, I want to make this happen?
I'm not going to lie that I have ambition, and I've always had ambition, but I'm at a certain stage of career in my life where that's not the primary mission in my life. I always had a mission orientation in what I do and who I am, and a philosophy around that. But I mean, everybody's lost some loved one lately due to COVID, or knows somebody who has. But for me, it became very personal when my father lost his life in a scenario at a place that had staffing issues. And I can't help but think that if we were able to provide staff that, and having a certain level of staffing at that place, maybe my father might be alive today. And forget my father and my own personal experience. Over and over, I hear and see stories of people who have lost loved ones, and forget about COVID, for XYZ reason at other places, right? Staffing at the core, people at the core are what make healthcare go. And if we provide a better way for people to engage, not get burnt out, have choice, and a supply that wants to work and fill shifts, that's doing good. And that's what I want.
Amazing. Just amazing. What an incredible undertaking that you've adopted for yourself. And I'm just grateful. This is what I want people to know. I have the privilege of being able to speak to many entrepreneurs and see the literal impact they have on society. You were one exact example of that. And often why I do this and have these conversations is because most people are struggling, and they're so caught up in just trying to find work and have work that they can't even see that they impact directly. Like, nurses don't see this. When we're talking about this labor market doesn't know how necessary they are. They know that they want this career and they're focused on what they're trying to do, but look at how important it is to the fabric, how it literally can change the difference between someone's life or death. And it's just incredible to see someone like you stepping into the foray here and being like, look, I can do this. And when I hear you speak, I immediately see not only the passion, but the understanding of what needs to happen. So how do you stay abreast of these things? How do you stay on top and keep yourself sharp on like, okay, these are the moves I'm going to need to make? Are you constantly rubbing elbows with people in Silicon Valley to understand where the money is flowing and then bringing it back? Or is it the other way around? How is it that you approach this?
The way that I approach it is always being open to conversations with people and really getting to know folks on the front line of the problem itself. So, two different sides. Okay, on the investor side, um, what I try to do is get to know who is in that landscape that's worked both in healthcare and in that environment, get to know what they're thinking and educate myself around what their wants and needs, and educate them at the same time. So it's more like a relationship over time. And, I make the pilgrimage out to San Francisco or what have you to meet people, to talk with people, but it's also other areas of the country, whether it's Boston, Nashville, Austin, et cetera. And I make sure that I'm at events and, are just open to meeting people. And I develop a network of trusted relationships that keep me informed, and I look to them for advice. On the healthcare side, similarly, I mean, I've had past mentors that are CEOs or ex-CEOs, et cetera, but I also try to keep close to the front line through our own product team and understanding what nurses and CNAs and executive leaders in the front line are experiencing and how we can better service them. So, when you're talking about me as an entrepreneur, I mean, I'm part of a team of entrepreneurs that are really changing healthcare, whether it's our technology leader, Derek, the CEO, Will, his partner, Sophia, or the VP of finance and the people ops leader, Alex and Suzanne. We're all into this mission and helping people. And our team, is really open to listening and learning and observing. That being said, we look outside healthcare and we recognize that other industries have moved along a similar path, and we try to take the best from them to apply to healthcare and take the best from healthcare where we can. So I'm tired of like everyone saying that healthcare is filled with dinosaurs. It's not. It's filled with people who want to make change. They're simply unaware of maybe some of the opportunities, and let's connect the dots and bring people together.
I love it. I love it, especially because, you know, we live in America, and there's this running joke that we don't have healthcare for everyone, right? But it's not as simple and most people know this deep down. It's not that simple, and we want it. But there's a lot of business and logistics that go into this, right? I mean, you have people who've gone to school for years. You're not gonna convince them to cut their salaries in half or down to a quarter just because everybody else wants to have, healthcare. That's not the way to think about it, right? There's a solution somewhere there, but it's not lost on me even. And I don't know anything about healthcare per se. So I know there's a solution out there. And if anybody can figure this out, I think it's someone with your mind, your network, and your drive and your vision, because there is some way to do this sound with business. Everything else has been scaled and made affordable. There's definitely a way to do this, but it's not going to happen overnight. And it's going to happen by being able to initiate new ways of aggregating labor forces and changing the modalities that they've been operating with and the way they hire people and what time structures. And once that flexibility comes in, I do believe things will get more accessible to more people. And you're going to be responsible for that. And that's why I'm super excited for what you're doing, Craig, and with CareRev. And so I want to lay out the red carpet for you. And if anybody's listening that wants to know more about it, where do they visit you? Where do they go check out what you're doing? What social channels are you active on? What's the word?
Yeah, I'm on Medium, and of course, I'm on LinkedIn. My own personal philosophy is I shunned Twitter and Facebook and Instagram. But you can find me in those other two venues. And you can just reach out through carerev.com. It's carerev.com. We're past the startup phase. We got customers and we've been proven. And we're just looking forward to being as familiar for healthcare as DoorDash or Uber is for their respective industries.
Absolutely. And are you open for investments, or has this all been like, because now that you're past startup, I'm sure at some point there's time for another round of funding, or have you bootstrapped all this?
So our team is going through different rounds, has gone through, different rounds. So we're always open to conversations, but we're doing well.
Oh man, I'm excited. I'm so happy to hear that. I guess what's left now for me, now that we've told people, and you said carerev.com, was that the website?
Yeah. Yes, that's correct.
Yeah, right on. And for anyone looking for you on LinkedIn, it's Craig Allan Ahrens. It's Ahrens for the
Mhm.
last name. So now I have this question I've asked everybody to indulge me in that's stopped by the show. And it's one I talked to you about before we hit record earlier. You are welcome to pass again. But the conversation's been so great. I'm genuinely curious. If you could have invited anybody today to join us and sort of hear what you're doing, what you're working on, and sort of chime in, maybe, join the journey here, dead or alive, who would it have been and why?
That's a great question. So I grew up reading a lot and looking for people throughout history as like kind of my mentors. It's kind of weird as a kid. Um, I would say probably Benjamin Franklin. I got a picture of him on my wall. I've always been impressed how he bootstrapped himself, navigated complex situations, and grew as a person. And he was very transparent about it and humble. And that sort of personality is what I've seen in terms of healthcare and people who actually are changing it. Yeah, he inspires me, and having more people like him in the world would make the world a better place.
You're the first person to bring up Benjamin Franklin, and I'm so happy to hear that. I love what Benjamin Franklin is about. I think he had this thing where once a week he would practice some kind of value or principle in his life.
That's
Like
right.
this week is going to be patience, right? And every
Right.
opportunity, yeah. So talk about a literal mindset for growth, and that's what we need in this
That's
world.
right.
So someone who's pushing things forward. So I'm excited that you said that. It makes more sense now when I reflect on everything we just talked about, that's the kind of ambition and humility that you bring to this mission. So Craig, thank you so much for stopping by. It's been an absolute pleasure.
Thank you.